Frank was diagnosed at age 50 with stage 4 lung cancer. It started with back pain, but Frank always had back pain, so we didn't pay a lot of attention to it until it got to a point where it really was bad. And by the time it was diagnosed, it was too far gone to do anything to really help him. But you know, hope is always kept in that secret little place in your heart. You wish for a treatment and anything that may have given him a longer and better quality of life. But then I realized this was only something I really dreamed about, that maybe something would develop. There was an answer, there was a cure, but there wasn't. And with the challenges of the healthcare system that were in place, and the fact that Frank was self-employed, a lot of people don't realize self-employment when the person making the money cannot work any longer. We weren't able to maintain our health insurance. And so I became all too aware that our healthcare system can be an illusion, really, of safety, and shrouded in the idea that we are meant to believe we're all covered and there is true help for us out there. I question, is there, and where to find that help? Where to begin? Who to call? And who would listen and get results? I wish I had known about Patient Advocate Foundation, because illness needs a business manager to handle the side effects of illness so that the patients and the caregivers can rest in knowing that financial concerns are being handled, someone to discuss different situations with. PAF can help build a team of support. It is not just the medical debt, it is also, which we don't think about a lot, the cost of living debt that can accumulate. Your everyday expenses. You know, we need to think about financial distress is definitely a side effect of care. And we need to think about decreasing the financial burden of our medical treatments, our care, our prescription drugs. And that would certainly, put a less strain on our own resources. So not having a powerhouse like PAF back then that I knew about, I had to go it alone. And it made the journey far more emotionally wrought. It made the journey feel like unbearable. But eventually we rise up, we rise above. I like the word navigation. I think it's excellent. It defines what we need in the healthcare system. Navigation to me, Chris, is to provide people with the resources they need to develop their own personal program, if you were, aimed at success. You need to kind of remember that anyone can be one illness away, one diagnosis away from financial and sometimes emotional devastation. So that health needs navigation must be part of the equation. A persistent support system advocating on my behalf that would not give up when I felt I just might give up or give in. My dear friend Eileen told me she had cancer. I told Eileen about PAF and that she should call them and do an intake in case she needed their assistance. And she did. A few weeks later, Eileen said to me, I have my caseworker, Sandra. She's a nice lady. She's my lifeline for help. And I thought, wow, what a way to put that, your lifeline for help. Eileen knew how to advocate for herself. She really did. She oversaw the nonprofit division of a veterinary hospital here in New Jersey. She navigated for pet owners to get them the help and funding they needed for their pets to be treated. She understood the importance of having someone who knew how to navigate, because she did it for pet owners and for their pet health care needs. But when it came to getting the medication she needed to continue her treatments beyond chemo, she found the biggest obstacle to her care. Her life was hanging in the balance. Her life at that time was dependent upon receiving these medications within a certain time frame. Eileen could not afford these medications, and her insurance company had denied paying for them. The unbelievable stress this put on her, not knowing how to get this medication, how to keep up with her bills, which is another way PAF helped her. She was given a grant to help catch up on some past due bills. It all started one day sitting in Starbucks with my dear friend and colleague at the time, well, still is, Colin. And we were discussing how we should consider becoming social entrepreneurs. You know, we wanted to be dedicated to belief that humankind is responsible for creating change. We're different in the fact that through our donor contributions and sponsors and fundraising alliances with various for-profit ventures, we create a stream of revenue which are channeled to charitable groups in the form of tangible items. So we're not giving money. We're finding out what the charities need, where there's a gap, we can fill it. So Colin and I joined some fellow colleagues to form Living for a Cause. And Colin named it that, Chris, because he felt people have died for causes throughout history, and that we all should be living for a cause. Whatever that cause is, whatever inspires you, whatever that passion is, to live for that cause, to make a difference in your life and a difference in other people's lives as you meet them. So Living for a Cause is a 501c3 organization with the goal of creating a place where people could garner creative resources to help their own philanthropic efforts. I'm very community oriented, grassroots. You know, where can we make the most change, and where can we create people to want to get involved, to create that spark within them. We hear no so many times. No is not a complete sentence often. To find organizations that identify and address unmet health, financial, and social needs, that would make a difference. Those equitable needs navigation services. But the most important thing is that these services, when put in place, have a proven record of success. The results must be there. Otherwise, what good would they be? And the patient needs that reassurance that the system is working with them, for them, that they're not just an invisible part of a structure that was created that we can get so lost in. That awareness grounds us and gives us hope, real hope, that turns into, as I said, a proven result. We certainly have to let people know in an easier manner where these health needs services can be gotten. Care centers, medical centers, hospitals, doctors should know. They should know to be able to navigate their patients to an organization such as Patient Advocate Foundation. The information should be able to be easily accessed, especially in underserved communities. I think if we partner with research, people looking to partner with advocacy organizations, and if we had a policy to scale and standardize health needs navigation, we could expand the availability. And expanding the availability and making it mainstream in our healthcare system, patients would have more opportunity. There are always opportunities with each new day. Think about it. The opportunity to meet someone new, to learn something new, to grow spiritually, to perhaps have the opportunity to help someone along the way, to bless them, to tell them about Patient Advocate Foundation, to do something productive and meaningful, to dream. Every day we can make and create new dreams, right? To be creative, opportunity to enjoy family and friends. That's so important, especially in the age we're living in. And I think it's important to know that all of us at some point can walk in someone else's shoes. It became personal by walking in the very shoes of those I once truly only heard about. The good folks who needed navigation, who needed charity care, public assistance, social needs assistance. And Chris, and now for a time, I found myself one of them, meeting them and sharing stories with these good folks, standing in line with them for the public assistance. Sometimes, though, the best way to understand a system and to see what needs to be changed is truly sometimes a blessing to become part of it for a while. And I did, and I found out how broken in areas it really is. This, what we call today lived experience, truly lit a fire in my soul to speak up, to speak out, and to stand up to create positive change wherever we can, wherever it's possible. I found out for myself, it was not so much in the actual experience that I was going through, but how I chose to use that experience in turn to ignite passion in someone else's heart and soul. It is all in the action we take after the experience and even during the experience. And this, more than ever, is not a time to sit back. It's time to get involved. And I think by going through various areas of assistance, social needs assistance, it put me in a different place in life. It put me actually understanding what that person is feeling. And so when they say, "How are you doing?" I understand completely.